Hello, my name is Shelby Aubuchon, and I will be presenting on how, as an ICU nurse, you can prevent the development of ventilator-associated pneumonia through the use of a prevention bundle. The intensive care unit is known to be an environment where the most serious of medical cases are cared for. The high intensity of these cases are often associated with the use of a ventilator. When any material is introduced into the body, there is a high risk of infection because of the interruption of the body's normal functions. The end goal of this presentation is to equip all intensive care nurses with the knowledge to properly care for those patients who are on a mechanical ventilator and to prevent the acquirement of ventilator-associated pneumonia. According to the CDC, in 1 year, mechanical ventilation has been a part of more than 300,000 patient cases as an essential part of their treatment. The artificial airway, while excellent in the opportunities that it provides, also comes with a high risk of infection, especially if it is not taken care of properly. A case of VAP can develop within 48 hours of the patient being intubated, which in turn will lead to a longer stay on the ventilator, a longer hospital stay, and an increased cost of care. The cost to treat this hospital-acquired infection comes with a price tag of $40,000. There are many risk factors that are associated with the development of VAP. One of the highest risk factors is the use of the ventilator well past the time that is medically necessary. The other risk factors include having a compromised immune system, the patient requiring surgery, or being elderly. As a nurse, it is essential to assess for these risk factors that put our patients at an increased risk and increased susceptibility to acquire the ventilator-associated pneumonia. If we know the risk factors of the infection and the consequences that it causes, let's now look at the way we can prevent VAP. The prevention bundle consists of 6 components that all have one goal. This goal is to decrease the number of VAP cases that are seen. The components of this bundle include hand hygiene, a set degree for the head of the bed, use of orogastric tubes, breathing trials, oral care, and breaks and sedation. The combination of these components will aid in our efforts to decrease cases of VAP. While hand hygiene seems to be a common practice, it is always important to restate the benefits of this practice. To start, hand hygiene should be and can be performed with a few types of products. These include either the good old-fashioned soap and water or the use of an alcohol-based hand sanitizer. While hand sanitizer is good, it is always a great idea to use that soap and water. This should be done before handling any part of the ventilator system, after handling the system, and any time you come into contact with a patient. By the use of these techniques, the number of VAP cases can be reduced by 59%. This is a huge number and improves the health of all that we come in contact with. As nurses, it is our job to maintain proper hand hygiene for not only ourselves, but our patients as well. The second part of this bundle includes having the head of the bed in between 30 and 45 degrees. The benefits of this position is increased in the ways in which it will assist our patients. By having the head of the bed between these angles, it will decrease the risk of aspiration should this patient experience this. Also, this will reduce the risk of stomach contents rising into the airways. The aspiration of stomach contents or anything else will lead to the development of VAP and can be dire to our patients. The semi-recumbent position is a key element of the VAP prevention bundle. Another part of the bundle includes the use of limited orogastric tubes in intubated patients. The use of an orogastric tube penetrates the lower esophageal, which reduces the competency of this sphincter. The lower competency results in the reflux of gastric acid, which can cause a wide variety of issues. Another reason to limit the use of orogastric tubes is to keep gastric bacteria from entering the airways. So this orogastric tube provides an excellent highway for bacteria to travel up into the endotracheal tube, which ends up residing in the lungs. The introduction of this bacteria can result in a case of pneumonia, which would be associated with a ventilator. The next component is the use of spontaneous breathing trials. This is done when the patient is assessed for weaning from the ventilator. It will gauge when the patient can be removed from the mechanical ventilator, which, as we discussed, can be a key component to reducing VAP. The spontaneous breathing trial should be done every shift, every time. By assessing every shift, we can assure that the patient is not left on the mechanical ventilator longer than necessary. Also, by removing the foreign endotracheal tube, we remove a possible source of infection and in turn reduce the possibility of VAP developing. Spontaneous breathing trials play a role in the next component in assessing our patients. The use of spontaneous breathing trials intertwines with sedation interruptions since they play the same role. The interruption in sedation is another key piece to assess if our patient is ready to be extubated. By reducing the amount of sedating agents that are given to the patient, we can truly assess the capability of the patient to breathe on their own. This assessment must also be done every shift, every time. We must assess if we can safely remove the patient from the ventilator so they are not left on the device too long. The last component of the VAP prevention bundle is providing oral care to the sedated and mechanically ventilated patient. So the mouth is the starting point to our respiratory system and must be cleaned properly to prevent infection. We must provide these patients with oral care to reduce the buildup of bacteria that is in their oral cavity. This oral care will include the use of chlorhexidine solution, and this cleaning solution will reduce the number of bacteria that is present in their oral cavity. In turn, this will reduce the number of bacteria that is available to travel down to the respiratory system and will reduce the risk of causing issues there. At the end of this cleaning, the patient's mouth should be suctioned. This will remove any mucus or junk that has been cleaned and removes any bacteria that's still lingering. As nurses in the intensive care unit who handle patients who are on a ventilator, it is up to us to ensure that our patients do not acquire any additional infections. We can assure the health of our patients by using the VAP Prevention bundle. This bundle, again, is hand hygiene, head of the bed at 30 to 45 degrees, limited use of orogastric tubes, spontaneous breathing trials, sedation interruptions, and oral care. This bundle has been proven to be beneficial and must be used in order to prevent ventilator-associated pneumonia. Thank you so much for watching my presentation.